Welcome, everybody. Good evening, good morning, good afternoon. This is Anna Achimowicz, your favorite physiotherapist, checking back with you on Med Talks in 2021. Happy New Year to everybody. So as we slowly make our way back into the new year, we're developing and starting new discussions and new talks that are ongoing on the topic of live shows coming back, the medical approach, the very much musical approach and point of view of that. And today in Med Talks on Performing Arts Medicine, I have a great colleague of mine, a great friend of mine joining in from over in Sweden, Wim Grooten, and I will be very excited to have this discussion today. And we're gonna talk a little bit about what's happening in the world, what the progression is, what the possible prognosis is, and everything pretty much in between. So if you guys are checking in on Facebook, on YouTube, on LinkedIn, and on Twitter, please hit the subscribe button, all of those good things, so that we get that out of the way. And without further notice and ado, I wanted to invite Wim Grooten from over at Karolinska Institutet over to the studio, joining me today for Med Talks and the discussion.
Thank you very much for this long introduction.
Make it longer. I cut it short.
Yeah, make it short. Very nice. Thank you very much. But you still pronounce my name strange. It's Wim Grooten, but okay, that's very difficult.
That's the creative interpretation of it, right? Yeah, like
yes.
It's what we use when we hang out together, when we do research or any other things in the lab.
But I cannot say Achimowicz either, so it doesn't matter.
I know, true. Like my name is unpronounceable. Anna of Performing Arts Medicine. That's usually how it goes.
Yes.
Welcome, Wim. Happy New Year. God Jul, as we say it in Sweden.
Yes.
I'm very excited for you to join today because not only do you as well have a double sort of education. You are a physiotherapist that is licensed. You work at the Neurobiology Institute and the Department of Occupational Therapy, if I have all of that covered. Basically, your field of work is very wide in sense of research and studies and biomechanical analysis that pretty much one-to-one tries to test whether something is positive and works and has an impact versus not necessarily not it doesn't.
Yes.
So I wanted straight off the bat, because we did back in the day, I think it was 2014 or 15, we did our little biomechanical pilot. We were analyzing ballet dancers with some specific movements on point shoes.
Yes.
So from that, we kind of derived into different fields of basically doing music, because you also a multi-instrumentalist. You happen to do both.
Yes.
So, tell me a little bit, Wim, wrapping up 2020 as we go into 2021, and also try to figure out how the live scene and how the live music industry develops. Tell me, where were you caught up when the whole pandemic basically blew up last year?
Oh, yes. It was a pity because I'm a researcher, as you say. So, but you need a hobby, and my hobby is music. And at that time, it was really going great. We had lots of gigs planned, and I have different styles. So I played jazz in one band and funk in another band, and then party music with covers.
And a little bit of rock.
And a little bit of rock, of course. You would never.
Yeah.
That's
I
always
that out of practice, so we will not hide it. Very versatile.
So all those three projects were running quite well, and then suddenly it was totally stopped directly. Everything was stopped. No rehearsals. Nothing happened anymore. And so I'm one of the lucky ones, because then I don't live on my music. It's just some extra thing. And that means that it was just back to the screen and not teaching anymore. And that's as normally we stand in the classroom, but it was just from one day to the other day. Okay, next morning we see on Zoom, and I never used Zoom, and then it was just going on, and that means that it really made my work quite difficult. So there's really no time to think about music anymore, and it was we just made it until the summer. It was 3 months without any music, without anything. It was totally locked down. although Sweden was one of those countries where have a little bit an easy lockdown, but they have locked down the whole culture section. So it was no concerts anymore, no gatherings of people. Although normal shops were open and schools were running, but everything on culture was just put on zero.
I think it wasn't only Sweden. I mean, basically the industry of live arts, of music, of concerts, as you say, all possible venues of shapes and sizes, ballet, opera, you name it, basically disappeared within one day, after another. And I'm actually glad that you brought that up before we kind of go further into our discussion topics, if you will. The fact itself that we were kind of thrown into this from day in to other day out without any preparation, without any transition, if you will, like everyone started to actually adapt, and many of not only performing arts artists pretty much, and then also us as medical specialists have figured out a way to kind of transition into the temporary new normal, because more and more the fact it's aside of let's say virusology, aside of COVID pandemic itself, aside of even biomechanics of the body, the emotional side of a human being is a huge effect. I mean, you work with athletes as well, so you would know best, maybe with previous research you've also done with athletes in sports, how much the mental state and alertness and positive attitude actually affects performance in any group setting or sprint, let's say, or a marathon.
It's an important thing to think about when you're talking about athletes. They're really performing on the highest level, and maybe a little bit over the top sometimes. And so if such a person gets this disease, this COVID-19, it will strike this athlete harder than a normal person. And that makes also, we have seen lots of those athletes that they have very difficulties to come back to the normal level, even 6 months after COVID. So that is, I think, one of the points we have to work on 2021 is the rehabilitation. How should we work with those athletes or musicians or dancers or everybody with this kind of problems? And one of the problems is the mental. They call it like brain fog. They are used to have several things at the same time. If you dance, you need to know the music, you need to know where the other dancer is, and you need to know where on stage you are, and you need to know what step you have to take. And everything is gone, because you can do only one thing at a time. And it's really it's quite difficult for them to get back. Another thing is, of course, that the lungs are affected, and we need to have new treatments to get the lungs working back again. Many people talk about like a strap around the chest. And
compression belt around the diaphragm.
And it's not that they cannot breathe in, but also breathe out is difficult. And now we have done some studies about how to measure this feeling of this belt around the chest, and it is quite difficult to measure this feeling. And inhaling like a mouth tube, you will measure this.
Almost like an incubation set, pretty much.
Yes.
It's similar. You kind of wear the mask for the VO2 max capacity when you measure that. But of course, in the lab, as you say, it's one of these not only hard to measure elements, but also it's not really quantifiable.
No.
I mean, for you, being a physiotherapist, but working 95% pretty much, not as a clinician as I do. I'm a full-on physiotherapist that works basically on the front line, let's say, of music bands and backstage and in rehearsal and so forth. So what you described, we actually talked about that briefly before we went on earlier, kind of backstage. But I find that also interesting and especially quite unprecedented as well, because as you would imagine, a human body that is healthy, very well trained, as most musicians these days are, especially bands that are big touring musicians, successful during arena and stadium tours. I mean, they years ago, they went off drugs and and substance abuse for yoga and for meditation and for running and cardio and gyrotonics and performing arts medicine that I provide as well. So all of that, there are individuals very much on the same level and caliber as athletes. But what's interesting that COVID does actually have that long-term effect, that it wipes out the body even more than, let's say, a regular person that would just train as a hobby, occasionally hit the gym. So for all of us, I think it's one of those interesting elements that we don't quite know how to approach, as you say, and probably new technology even for measuring that is, and especially for the mindset, right? That is not just a feeling, it's just subjective, and we all have that a little bit different depending on the psyche, pretty much.
Yes, of course.
Their science has a pickle to kind of approach that.
Yes, of course. There are some measures on measuring this kind of brain fog and cognition and things like that. But of course, they're not very sensitive for change. But you can measure, you can do that. One other thing is, of course, the VO2 max. It's really low, and it is quite difficult to get those people back when they just have this little uphill walking. They feel exhausted, and it is very difficult to set the right level of training to get it, because sometimes you push them a little bit too hard and they will go back in 1 or 2 weeks. So I think one big thing is the rehabilitation of the patient. So one thing is, people say sometimes, COVID, it's not that important disease. It's just like a flu, and you will get over it. No, it's not like that.
We did learn over the year how not only fatal it is, but how complex it works on the human body in terms of systemic effect, which is pretty interesting. In a way, it kind of invades it in a very complex way. Not much is being known about it. I mean, however much research is being done currently, not all of the research, we can trust still in the medical field, but the good element of it is that it is being studied. It actually is being tested. From what I know, also the UK new streak is being tested as well. And hopefully the vaccine has that covered as well with the official information that has been stated. But again, coming back to this complexity of not only neurological skills and coordination and the brain function and respiratory system, but basically we would need all of that in dance, in sports, for vocalists, for bass players, for guitar players. I mean, these days, how the format of live shows have changed, and by that I mean no one is standing on the stage anymore, stationary, just playing their instrument in a 2x2 square feet cube. They run around, they jump off of heights, you have backflips, you have all of those interactions. So basically you need all of those elements on a very highly trained level to pull those shows off, not only to not injure yourself, but to give a certain quality to the audience in showtime. So that for sure will be one thing to think about. From what we spoke about earlier, we actually saw recently one of the latest research happening over at PAMA, which is the Performing Arts Medicine Association. I think it was from October, and among others, they were analyzing the aerosol spread within singers. It was an opera, an orchestra kind of setting, so classical music, and different elements, but the basic kind of format is the same. We have a live stage situation. We have multiple performers on stage. I wanted to ask your thoughts on the research. What did you think about it?
I think it was very important for everybody in this field to have a look at it. Maybe you can put on the link somewhere.
I did.
You did that already. It's because it was
now as well.
It was the 2nd of November they had this, and it was about 2 hours, so it's quite long. But you can stop and you listen to it. But it was mostly about the risk of preventing to get it to. So they started off with this with airflow and see the effects of good ventilation. And I think one of the take-home message was that after one rehearsal, you need to open up the space and to get people out and new air in. So you need to be sure that you have changed the air, and that is quite difficult to know, because nobody knows about airflow in a building. You just open the door and there's air inside, but you need really to check out how long is the time for one room to be clean. And of course, if you do a dance or music or singing, then of course this air is used much more than normally. Yeah. So you need to change it much often than you think. So that was one new thing I heard about. And of course you can sing with a mask, but that's quite difficult.
It's rock and roll and
yeah, no. But
genres where you really have to push your voice out, right?
Yeah.
It requires heavy breathing, right?
Yeah.
So that is challenging as well.
Yeah, and one of the things they say, like, if you have people in a room, then you shut off the music there, because then if one people wants to say something, then they don't have to shout over it, over the background music. So it's really important to have like this culture of keep it quiet and keep it nice. So the screaming and everything is affecting everything, and of course keeping distance. So about 2 meters. That is what people say, and nobody knows what 2 meters is. If you think it's a bed, a bed. So you need to have a bed in between each other person.
A very simple explanation a while back. It was still in 2020. 2 meters or 6 feet is 2 lengths of a Telecaster or a Stratocaster. Yeah. No product placement there intended, but basically one, and then the other, it's that distance. So it would
very
be like
far away. Yeah.
Next to each other. One of them is right-handed, the other one is left-handed. So there you go.
Oh, yes. Yeah. So that's really good to have. I think maybe if you have like a small bands and you have a big room and you sit everybody in its all. For example, the drummer in the with the plexiglass and the piano in the side. Do you think, okay, everybody is safe here, but you're not, because the air is running. So you need to change the air every 20 minutes or every 45 minutes. You need to have a new air, and also to think about these airflows. So the singer or the saxophone player, where does he put his the airflow? That's mechanics, but it is something we need to think about. So
that would be already, sorry to interrupt you, Wim, those would be already 2 very big elements kind of that we all would need to not only think of, but also maybe in collaboration with whoever is creating the design, with experts that are basically building stage and doing management and maintenance on ventilation systems, the central system, because we know outdoors is a completely different version. Yes. There we already know that the virus spread is way lower. There's a lot of space. All of the particles they kind of diffuse way better. But the indoors is what's most challenging. So yes. That would be one aspect. And the second one, well, you mentioned drummers behind the plexiglass. basically that has been done before, not even,
not for the COVID, but now we need a roof on it also.
Loud. That's the only way to shield them down.
Yes.
So that already could stay. Everything else, I guess, would be questionable. I mean, a couple of bands over 2020, they actually did some live shows, not only the drive format, kind of cinema layout, the cubicles that were really socially distanced and kind of resembled a full-on stage production, because the band was in full cast. There was a full stage crew, but the audience had their small little group, so anyone you would kind of bring together from your, well, safe circle, if you will, family and friends, with temperature checks, although that we already know it might be efficient, but on the other side, it's not 100% really efficient. As we know, the symptoms start 7 to 10 to 14 days after infection. So that could be a little bit tricky on that level. But then again, the indoors, I think would be one thing to look at, and especially introduce as soon as possible, because that might actually come back the latest, especially with full capacity audiences. I don't know if you saw Brian May actually post something. I think it was mid-2020. He was actually with a group of experts, and I can't recall right now which theater it was, but he was over in his local town in a theater, completely shielded off from any audience, any other entry. It was just shut down from the repertoire, but they were investigating a way to kind of not only install vents and in the floor, find any kind of airflow and possibilities of building new infrastructure for literally like an old school theater lineup, when you do have this diagonal rising up audience, which also in a way creates a different kind of airflow, different distribution of audience. So I thought that was really great for him to literally, as a performer, as someone on the practical side of things, kind of give his ideas. And I don't know the details of it, but I did see that they were working on something. So hopefully maybe we hear about something like that soon in 2021.
Yeah. One of the things with the indoor activities is also like you have this bottlenecks that people have to meet each other through a doorway, and it's mostly not regulated. And you cannot be 2 meters away from each other in the doorway if you meet somewhere, or in the drinking coffee or something else, you know. So these things is really have to be thought about. So I think not only about performance, but many of my friends, they are musicians, but they make the money by teaching. So lots of the teaching activities is one-to-one, and of
just
course
like as well, Zoom,
and then these kind of things can be done on Zoom, but not always. I just found one report on vocalist trainers who were thinking about how to do it, and of course you cannot hear vibration, you cannot hear the tonage and the things it's very difficult online still, but of course it can be done, but you have this delay and things like that, so the timing is very difficult to do as well. So
it's a good addition, say for practical training. I've given a bunch of body management individual classes or physio consultations like this, but of course anything that is based on working with the human body and in real time and real terms does not translate. And funny enough, I've spoken to many performers that were actually performing also last year, and they said the same thing. We've been working out really on a high regimen as if shows would open up tomorrow, and it did not translate to stage. They were the most out of shape people ever. I mean, the breath is completely different, the muscle tone, it's not the same. However much time you spend even at an outdoor gym, because that's, physically different shape. For the moment, it does not translate, and even I can say that by myself, being a stage performer aside of being a physio and a chiro, it's kind of halfway there to keep you in shape, but on a very basic level. It's really, very physical and advanced show. So, but if not that, probably everything would happen over Telegram, and imagine all of us managing this time without even this kind of contact, and feeling that we are in the same room or
yes.
studio. So better than nothing, I say, right?
Yeah, better than nothing, of course. Yes, I think one of the main speakers from this webinar was the guy, the singer of Kool and the Gang. It's called Senny Martin. I don't know if you seen it, and he put it very nice that he said we needed 3 C's, and then the first C is courage. Just to do things that we never have been doing before. Just go for it and try it. I'm now online with a thing is called BANDLab, and people post some music, and then I put some extra piano on that, and then back again. And it's just
BANDLab, and I created BANDAid.
Yeah, it's great. So that's just courage, and just to play with anybody, and you never know what will happen when everything opens up again. Maybe you find some context. So courage to do things, and I remember there was one Swedish dancer who has made a production with Finland, Russia, and Norway and Iceland. So those 5 countries they never met, but now online they made one performance. So they were dancing and seeing each other on the screen, and then interacting with that screen, and then so it was really nice to say, if I didn't have this courage, I have never sent the email to them, and we should have never had this thing. So that's, I think courage is one thing we need in 2021, just to see. And then he also, the next C was his about collaboration. We need to collaborate more. Everybody can sit at home and rehearse, but you never get a good piano player if you only play by yourself. You need this collaboration. And of course, with this delay problem, it is very difficult, but of course you can send your files to anybody. And so I have many people now working on, at the moment we made a 45 minutes one funk song. We call it the funky opus #1. So it will be 45 minutes of funk, and I just sent one bass line, and he puts on the drums, and we back again, and it's sent to another guy who sings something. So that's, I think, collaboration that makes people work together and see what happens. I don't know, but I just get the news that we have one guy who wants to put this on Spotify. I say, yeah, but I don't want to pay for that. No, but he pays it. I want to hear your funky opus, 45 minutes of funk. Let's go.
Well,
okay.
I recommend already, not on a medical note at all, better to put it on Bandcamp, because that's a place that is a little bit more friendly towards musicians and creators in the first place. So have an alternative, maybe you can think about that. But yes. 100%, I couldn't agree more, Wim. And I mean, we know each other for a while already, and not only, especially I wanted to have you on the talk today as my co-partner in discussion, guest of honor, if you will, of 2021, because more than anyone that I know also in your field of work, I remember from us doing research back at Karolinska Institutet that you have the most positive outlook and attitude towards things. And that, I think, more than anything, however hard it is to really keep up, and 2021 is like, okay, 7th day, but we're still here. I mean, not much in that sense, but then it has, like, speaking of collaboration, I want to briefly stop over this, especially yesterday. I actually, you might not know this because this is super recent, but I wanted to tell everyone watching us today right now, I've put together this performing arts medicine info and support group yesterday. It was a very kind of inspirational, super quick thought, but I figured that not only this kind of discussion where the whole industry comes together and tries to, address the problems and address the challenges, which already pretty much most of them we kind of realize, but still more and more are coming up as this unwinds. But in order to have the live arts come back as soon as possible, we need some sort of center for resources. And by that I mean resources that are not only valuable, but are also kind of places to go to find help if you need mental health, if you need a motivational kind of talk or exercise program, if you will. Same for ongoing research. I'm very glad that you actually saw the very same seminar that I did, because this kind of triggered me to start the support group, because I haven't seen any out there. And if there are, please guys, if you are watching us on MedTalks right now, please send that to our social media. That would be very, very awesome to share, because I haven't seen that. I've seen a lot of discussion, but in separated groups. The medical field kind of discussing amongst purely infectious rates, purely vaccines being developed, but I haven't seen a real actual meaningful discussion in order for all of us to come together. Because to be honest, as much as separated it is, and we are supposed to right now, with quarantines, with precautionary measures, of course, as hopefully the vaccine is being distributed, we need these kind of solutions to be found, and having that community kind of feel, because you never know, maybe and it's kind of thinking out loud, to be honest. I thought about this also when I was watching the KISS live stream over from Dubai, which by any means, I mean, however big the band is, as the biggest in the world, you know, they're the richest, the most successful, the most bombastic and loud. On a medical level, what they kind of shown, at least from their documentary, from the pre-show, that they did have a medical complex, a big hospital that teamed up with them, and they were introducing all of the measures, that they kept staff in groups, they kept crews in groups. The quality of that, questionable, of course. None of us that hasn't been there does not know so far, but maybe that's also the new kind of future of big touring bands, that they do have to employ, for example, staff to travel with them at all times, not only do the testing, but do the physiotherapy on location, as you say. Anyone that could be post-COVID or get infected. We don't want that, of course, but if someone did, they would need immediate rehab. I mean, we even know with ankle subluxation or fracture, and I think we even actually analyzed that on Point Shoe. That
we did.
The extreme kind of well, I like the word right now, but extreme factors that define a performer of the 22nd century right now, because it actually is. Maybe that would be the kind of new normal to think about and try to implement at the same time.
I think it's because in every sports team you have a medical part. Why not in a band? In a band, it's incredible.
As always, if you probably don't know why, usually it's about funding and about money, right? Another member of crew, of staff, that has to have a hotel paid and have their flights and, you know, this and that. So of course, when you calculate that, you try to minimalize and have people that do multiple things, that are practitioners and, I don't know, photography and then stage management and managing crowds, whatever. But maybe that's exactly the field where new professions could pop up. What are your thoughts? I mean, and over in Sweden, it's a little bit different. Then again, music and the culture has been on the very highest level, always, from early education. I could say the same about even Karolinska Institutet, where you are working currently for a number of years. It's one of the biggest medical universities, if not the main, for research and, well, the state of arts, actually.
Yeah. We have every year we have one seminar about arts, and then people who are working at the KI, they are also performance. So we have always this, and I think arts is like being creative. I'm sorry, and that is science. If you're not creative in science, you're lost. So I think those 2 points we need to have it. So that is the first C I want to add here. Creativity. We need to think in new terms.
For sure.
And now it's the whole world. The playground. The rules have changed. We need to think in new terms.
There are no rules at this point.
No.
Like, you build all of that from scratch. Of course, each country has that a little bit differently. You know, some countries are a little bit ahead of us. Australia has been recently. Same for Asia. A little bit different standards. Not even to mention, well, mask wearing as a standard, even with common simple flu. And I'm repeating myself actually here, but I think it is kind of a good example in terms of general social responsibility. Even, I mean, we don't think about that, but every single performer that is a touring performer and traveling most of the time of the year, they know that when they go on an airplane, on a train, or on a bus, like almost 100% guaranteed that they will get sick at some point. It's just that much flow of bacteria, that much flow of any other sicknesses, as we know. Sometimes the filters are questionable, the food of the facilities as well. So it's exactly one of these things that stay for longer. Have you met any research that is actually being taken place right now over at Karolinska on masks themselves, on mask types?
No, but the Swedish approach to mask is that it doesn't help that much as that we think. It is shown in studies about this flow, but if you keep your distance, and people with masks, they tend to touch them, and when you touch them, your fingers gets infected, contaminated, and then you put it everywhere.
And so basically phone a million times a day, like anything. And there's multiple, even like simple TED Talks, right? And tutorials that we see in a UV lamp, how much all of that is actually stamped already.
And then you see those masks hanging under the chin and then back again. And so I think masks will give you a false feeling of safety, because they are not safe. I have been doing a study on surgeons. So I was about ergonomics then. So I was in the surgeon room just to see their occupational standing and things like that. So and then I see it took them about half an hour to put on their clothing to be safe. And then you are safe if you do that, and then you stay there in that room. You don't touch your face, anything. If you touch your face, it's gone again. So that's the way you should act if you want to be safe. But now people just put it in and then they put it in somewhere here and then put it back on. It's so bad. I think it's
with anything. Terrible. Basically, the proper way to use anything will do the job, right? It's the same like after a bone fracture, you need to wear a cast on your leg, and if you wear it backwards, right, or if you
it doesn't work.
Not aligned with the joint angle and all of that, it will not serve its purpose. So like in layman's terms, it's pretty much kind of the same thing. If you wear it properly, it's supposed to do the job, minimalizing, but absolutely 100% on the surgical thing. I mean, of course, being a surgeon, when they go into the field of an operation room, and I've also assisted multiple times on these at Karolinska Medical Center over in Poland, the same procedure, basically you take extra over-the-top measures because you have an open operating field. I mean, you have open tissue, you have direct access to blood, hence direct access to infection. Here with COVID, we know that that's not the case. All of this is transmitted with droplets. So then again, if you want to be 100% sure and like keep minimalizing the risk, because pretty much it has been minimalizing basically and ducking bullets a little bit. And none of this is 100% effective, as we know so far from the research. But the more we minimalize it, for sure, that might contribute to lowering of the spread. And that's basically what we're facing over here with everything going on right now. I mean, trials for shows coming back, and as well, the vaccine being distributed on a massive scale. Hopefully, all of this will contribute to good practices and to good habits at the same time. But yes, within the show setting itself, it's also very interesting. I have one question, which is maybe not necessarily related. Oh, and I saw Wim drop out. I hope he will be back with us shortly. But here we go. There we are. I thought I lost you for a moment.
lost somewhere in. I don't know. I use my internet from the telephone. It break down,
Well,
Never safe.
it's one of these lovely things called the internet, and everybody is using it now.
Yes.
Probably as we speak as well. So yeah, you Wim, also being a musician, how would you see on this side of the spectrum what would need to be implemented as, well, kind of like an ABC? You already mentioned those: collaboration, the courage to kind of jump into a new setting and kind of take chances, but definitely not an infectious level, but chances in the sense to actually implement new ways and methods to rehearse, to gather, to start up, well, the industry that is pretty much right now frozen, as our picture just were.
Yes. Yeah, no, I don't have the knowledge on which kind of technology it should be used, but I think some kind of technology is needed at the moment. Now I think you're lost again. I don't know. I think it's.
I just gave the mic over to you.
Oh, thank you very much. But you disappeared, so I was thinking you were gone. No, but I think. I hope that the state or our government and our local policies or local institutes that they understand that it is so important with culture, with arts, and with this kind of performances, and that they put some money available for us. We have done now. For this Christmas, I have some friends who has been being on the streets since March, and they were really like, we need to do something, and especially Christmas time, people once they really want to do something. So we went into our local cinema where we can sit 5 meters away from each other, and we made this live stream. And then when we went around our local people, like stores and people say, okay, can you sponsor, because we need like a film team, we need Christmas trees and streaming, we need everything. So the budget was about 4,000 euros or something like that. And then we noticed that it was really like, oh, you are going to do something great, we will sponsor this and that, but not from the governmental. They say, oh, no, we shouldn't do anything with COVID, we should be locked down, we shouldn't do anything. And that was such a pity, because if they also see the need of this kind of events, I cannot walk to a shop without people stopping me. Hey, Wim, that was a great concert. Everybody has seen it. It was such a nice thing just to do. And I'm not very much into these Christmas songs, but I did anyway, because it was really necessary to do this for the people sitting there in quarantine. They don't have anything. They cannot go to church. They cannot do anything. So something has to happen. And easy live stream was just 1 hour of music, and it gave them this Christmas feeling back again. And the government doesn't understand it. It's so petty.
I didn't know that you guys did that.
I can put a link if you want. It's still there.
Played Christmas carols.
Yes, but it was nice music anyway. So
that's one of these things. A couple of weeks ago, I've actually seen a post by a very famous conductor over at Hungary, and he said one very simple thing, that basically any stand to a healthy culture, to a healthy society, is arts. Is it arts outlet, and the live arts even more so, meaning music, dance, performance, theater, you name it. So in my mind, that would be the complete way to go. Why governments have decided to shut down culture in the first place, I dare not even imagine and think why. It's just we know it's a fact, but what we all definitely want, also as a result, partly from this discussion, from Med Talks, and from your activity with the live stream, giving some culture to everyone that needed it at the time, also, but especially also as a researcher. With my work over at Performing Arts Medicine, I think now is the time to kind of, as you say, get collaborative and start talking, but enough of talking, more even into action, right? Let's kind of take the measures into our own hands, because if we won't, for sure, no one is going to do that for us. So,
but maybe it was one of those first studies published that it was like in a local breakout of COVID was due to singing. It was a lot of choirs in the very early stages when 70% get affected in a choir. And in Sweden here we have a big choir culture, and many of all the people were there. And so that was one big source of infection, and maybe that's why the government say no more singing, so they cut down everything.
Well, but with this logic again, super big malls, daily commute transports, transportations like trains and buses, full capacity. I mean, from what I've seen, some airlines have been very successful, and their policy was quite restrictive in terms of socially distancing, no meals, no drinks on board, mask wearing, of course, and so forth. But many of them haven't. So to be honest, it's kind of an uneven battle, but for sure, it always comes down to the individual, right? All of us kind of know what protocol we need to follow. And quite honestly, it's quite simple. As much as all of us love to socialize and gather, that's how we're made, basically, to be social, to interact, to be close to one another.
But you should have this mindset that if you meet a person, this person could have COVID without knowing it. So if you have that mindset, that you keep your distance. And
there is COVID fatigue, right? I mean, us not even me or you being special mental health, but basically that's one of the problems these days, that everyone is tired of the topic. It's okay, you can't see the enemy, therefore it doesn't exist. You don't see the air when you're in water. And I think it was also mentioned in the research that we both watched. They were explaining that we do not see air. We don't see the activity, the way the wall builds up and where it has the trajectory. Therefore, it doesn't exist, right? It's not material. So it's that harder sometimes for masses, I would imagine, to imagine and visualize, okay, there's a potential danger. We kind of tend to brush that off, and we shouldn't. We definitely still should kind of think that even anyone in your close surrounding could be potentially ill. Therefore, mask up, lather up as much as you can, and hope for the best.
Yes.
That's a great segue, basically. It feels like a deja vu from 2020, but then again, it doesn't. I mean, within the whole year, a lot of research has been done. Not all of it we can trust still. What is the prognosis, since we're on the Swedish topic? Because I'm also there quite a while over the year, more arts related and more into workshop and also teaching. What is the prognosis right now within the next couple of months, let's say over in summer? I did see some festival confirmations and some actual plans for live venues. How is that looking up? Have you heard anything?
No, not yet. I was lucky. I booked now my first gig in the 14th of August. We hope that, but no, there's nothing planned. And I think that is also one of the main problems that people with this kind of big shows, they need to know what's happening in August. You need to make a show, you need to rehearse, you need to do anything. But if everything is on hold and they just postpone 2 weeks or 3 weeks. Now, for example, they started with the schools, and then they say, okay, the Kurdish schools should not start at the moment. But when should they start then? We don't know. Maybe we'll see in a couple of weeks. So that is postponed, and nobody can plan anything. It's really impossible. So 2021 is gone for many of those big things, but that leaves maybe the door open for the smaller and the faster things. Like, hey, we will have a gig next week, but mostly if you have this for a living, you cannot do it like that. So I've seen now very many people who's searching for other jobs, bus drivers and working in shops and everything. And it's terrible.
If it's your only profession, I mean, it is art. Of course, you do it for the love and the passion. It is a very specific kind of job, unlike any other. It has its challenges, but within this situation, exactly, the whole last year was basically like that. And I think the sooner, not only, well, governments is one element, but the sooner kind of the private sectors also acknowledge that and kind of get work into action, in my mind, it wouldn't be a bad idea if all of a sudden way more booking agents or managers or companies that represent have any kind of database of artists that are freelancers. They, as you said, start putting together these smaller venues and lining up a couple of artists, trying to keep the program as spread out as much as they can, maybe repetitive, maybe a kind of residency. I've been talking over the course of the couple of months. They were also here on Med Talks like you, Wim. They were talking about the idea of residencies as well with hotels and resorts and casinos. As we know, there are plenty of those, and maybe the ones that have the infrastructure, maybe they could introduce that to the program as an addition as well. So for sure, there are many untouched territories still and ideas that could, in theory, work, right? The rest is kind of really trial and error if they do in practice.
Yeah, I think it was very interesting because the shops are open, all the shops are open, but you're not allowed to have like an art performance. So one of the famous singers here in Sweden, he posted like, if I start to sing in the IKEA, will it should then the police close IKEA because suddenly it is a concert? And I love this kind of thoughts because that shows how stupid it is. Yeah, how stupid. Why? So people can walk with this, but not sing. It's I don't understand it.
I've seen a post from an owner. I can't remember where that was. It passed very fast somewhere on Facebook in my feed. And private owner of an ice skating facility, he turned it into a flower shop, basically. They all had to be, in a freezer kind of situation. So, and I love the post and the comment because it was also creative. We do not care if our clients do backflips, slides, reaching to the flowers that they want to buy. As long as they do it, we're very open and happy to supply.
Yes.
Exactly what it speaks to the whole paradox of the situation, that in a way there has not been much thought, like all of a sudden we all shut down, everything comes to a halt, but everything else is kind of still in the gray sector, as we know, like in medicine, there is no white and black, there are just shades of gray, basically. So something to think about for sure.
I think so too. I think we should also lift a bit the positive points. I think the musicians now, they have much more time for the family. I don't know if that helps, but most of them, they're always on the road, and now they're at home. And finally,
well, we were laughing with everybody in the community and also here, basically, that it's a given timeout and a mandatory vacation for everybody that has been on the road.
Yes.
Has been working extremely, not sleeping in good conditions, being constantly jet lagged. Any artist that is on tour, basically, and is a successful, be a dancer or musician that is on tour with performances, they know how hard it is on the human body and how the regeneration is needed. So exactly, that's one positive out of it. You are taking a rest. Maybe within a world pandemic, you can manage your own health, but you can really express it in a personalized way. Eat well, sleep well.
Yes.
So,
Yeah.
and also workout, finding a way to work out.
Yeah, and maybe also one other thing is not everybody writes new music, but I think for the writers they have the time to sit and write. And I hope now when it's opened that lots of new shows are coming up, and it will maybe give, like everybody has been waiting for it, that it will be a big like explosion of new things coming up. We might think about it in that way as well.
Imagine the amount of music that is written and put out on records right now. When it goes on tour, it's going to be a massive happening of the century. I wonder if it's going to be the same with actually research papers and publications within the field as well. What are your thoughts? You're in the very center.
Yeah, but no, most of the research is also down. We cannot meet people anymore. We cannot make, for example, oxygen measures. No way that I walk around among people to do that. So much of my research has been stopped. But on the other hand, we have this COVID-19 research funding is coming, and it goes very fast. The ethics procedure goes fast, and there's lots of things you can do. So maybe in COVID research it's happening something, but in other research it's mostly dead. It's really stopped. So no papers on that. So what we're doing at the moment is to finally have the time to reanalyze our data. We have collected so much data. Maybe you remember where doing one experiment, you have tons of data, and now finally you have the time to analyze that. We don't need more data. We have already data.
We have enough. Yeah, I think we were overloaded with the amount of data because we were not only doing active markers with high velocity cameras, but also muscle activity and force plate, I think.
Yes.
2 or 3 components at one go. And I got to say, for a pilot, that was pretty complex already. And yeah, the amount of statistical analysis you need to do is massive. It's like a 10-year project, basically.
Yeah.
But the attempts are always great. We managed to analyze 8 dancers, 9 including me. I was like literally the 10th rabbit, wearing the point shoes themselves. But we did analyze the ballet dancers over from the Swedish Royal Opera, which was fantastic. This is the main prime group, if you will, of professionals that can actually perform and show what is done on a very high level. Same for musicians. I mean, and if research continues, especially on analyzing the breath, the endurance, and everything that might be a side effect post COVID, I think it will be a very creative time also to develop rehabilitation protocols. And physiotherapy, and maybe finally acknowledge how actually complex it is, because it does not focus purely on, let's say, massage and relaxation. That's maybe 15% of the work, but everything that is connected to it is mobilizing by hand, having joints that are increased movement range, working on the soft tissue and fascia and so forth. So I think even for masses of people to realize certain professions all of a sudden could be interesting, that they will realize how needed and crucial they are, because again, in sports and in music, in dance, for those artists that are successful enough to have that medical staff and assistance, even pre-pandemic, I was working with one of the very successful touring bands in February of 2020. But everyone else that is a freelancer, a different artist, we know that those people actually struggle many times to get medical attention due to funding, but also they do not necessarily know where to look. I mean, if you can already bend over and stretch your feet, that's how flexible you are. It means you do not need help. It's just like basically, okay, thank you very much, out the door you go, right? Like, why are you paying me? But those professionals face a completely different vocabulary of injuries, and same for music, same for any instrument-specific injury. So that I would feel that is a very open scope for future specialists and further research and practices to be introduced. And I think that's a good thing that we can take out of this as well.
Yeah, I hope so.
Guys last, and I think that's a good way to actually wrap up on a positive note that a lot of good has happened already, and everybody is working basically to get this thing up and going, and hopefully we will all see each other sooner than later and in practice and in the real world, as we say.
Not on a screen that freezes sometimes.
The screen is fine, but it has its challenges too, right? Like the band is being compromised quite.
Yes.
So,
yeah.
thank you so much for coming on. Very glad that you found the time. I know you are a very, very busy man, and we will not mention how many thesis papers you actually have to analyze and grade and still read. So,
terrible.
To do this, and thank you everyone that tuned in today. You've been watching Med Talks on Performing Arts Medicine, and again, guys, please hop onto the social media to find the support group, and if you have any interesting resources that all of us can use from whichever field, basically please post it over there. Be in contact with us, be in discussion, so that hopefully we all resume our live shows and the live arts industry in later 2021. So thank you very much for watching, guys.
Thank you for having me. See you.